Last time we had just an introduction of the show. The name of the show is Addiction Unmasked. We want to unmask this giant called addiction. And even before we continue, let me just introduce my guest. Give her an opportunity to introduce herself. Karibu sana to the show. You can introduce yourself.
Thank you very much. So my name is Christine Mukina. I'm a psychologist by profession. I'm working at a rehabilitation center called New Chapter Place Rehabilitation Counseling Center. Yes, I'm very happy to have this opportunity to talk about addiction and talk about how addiction affects people in general and to generally unmask it step by step. Yes.
Wow. How are you feeling today?
I am feeling energetic, I'm feeling very positive, and I'm looking forward to a very good session.
Wow.
Yeah.
Now, to our viewers, if you have any question, any comment, just join us in this conversation. The number that is on your screen, you can send your comments using that number. And if you want even to be on this show, you can reach us out using that number. Now, we had introduced this topic on addiction. Maybe there are those viewers who are not with us during that time. Maybe you can just remind them what is addiction. Now that you are counseling psychology from a professional point of view, what is addiction?
Yeah, so addiction it's a chronic condition whereby an individual is affected both physically and psychologically. Whereby an individual is affected both physically and psychologically, making this person not realize that this substance is causing them harm. You know, it can be both substance and it can be also behavioral. In behavioral, there's also behavioral addiction. So addiction goes both ways, both substance and behavioral. Yes.
But the baseline that this is a disease.
Yes, it's a disease.
Uh-huh,
Yes, that's the baseline.
Yes. Wow. And we're also able to discuss on the how addiction develops. Would you mind maybe taking us to just within a very few seconds?
Okay.
Just let our viewers know how does this addiction, now that it's a disease and every disease has stages.
Yes.
Right?
Yeah.
Now, this addiction being a disease, what are the stages of development that qualifies now to be a disease?
Okay. So we have 4 stages in addiction. The first one is experimental, where the person is trying to experiment this drug for the first time. The second one is regular use, where this person is now using these substances on a regular basis. The third one is problematic. Now it starts becoming a problem. This person is maybe not engaging in the things that he or she is supposed to do. This person is not attending work. If it's school, they're not in attendance. It becomes a problem to himself, to herself, and to the family. And the third one becomes now dependence. That is basically now addiction. You're not dependent on this particular substance. For you to function, you have to use this substance for you to continue the day-to-day life. That is now dependence.
Dependence.
Yeah.
And maybe our viewers can we can let them know at what point should an individual look and say, now these are the signs and symptoms of this disease? Because we are just doing a small recap on what we did in the previous show for the sake of those who are not with us, and just to create this, because the aim of this show is just to create awareness and also to inspire hope. Now, which are these signs that we will see in an individual and say this person is sick? Because you have told us that addiction is a disease,
Yes.
right?
Yeah.
Now, which are these signs of this disease?
Yes.
And at which point will this individual now need to seek an assistance? Maybe a medical assistance, psychological assistance, counseling assistance, maybe. Yeah. You can let us know.
Okay. So when you start noticing the signs, when it becomes problematic, that is when you start seeing that there's a problem somewhere, because you're not doing the things that are expected of you. But you don't have to wait for you to reach rock bottom for you to go and seek help. You can realize that you're becoming a regular user and decide that you're going to seek help at the second stage of addiction. You don't have to wait until you get to problematic for you to seek help. But the signs are usually there. When you start seeing that you're not doing what is expected of you, that's the first sign. You start seeing that you don't have energy to do anything or to function, that is another sign. When you start seeing that you're getting withdrawals every single day, you have to take, if it's alcohol, you have to take that particular drink for you to function. That is a sign that you need to go and get some help. Yes.
wow, wow, wow. So all these signs, and there's something very important that we have mentioned, that you need not to get to the rock bottom to seek for help.
Yes.
So if you notice these signs as early as possible, seek help.
Yes.
Wow, wow.
Yeah.
And now the topic of today. Today you are just going to cover the main and fact about addiction. And I don't know whether you are ready to get these things. I know you have also your mates, what you have heard, what you have heard people say, or what you know, or the myth that you have, or the myth and also misconception about addiction. You can just comment as the show goes on. And but now let us hear from the professional point of view. Now, myths about addiction. And when I was preparing for this topic, I kept asking myself, could these mates be the reason as to why people get addicted? But now, before the end of the show, I know we'll get that answer. I know our viewers could be having that question too, asking themselves, these mates and also this misconception, could it be the reason as to why people get into either substance or into a behavior by the time they know they have already been addicted? Could it be the reason? But let's hear from the professional point of view. Now, mates about addiction. Yes. Mm-hmm.
So myths about addiction, we have quite a number. And I'll start with the first one being that addiction is a choice.
Wow, wow, wow. So it's a myth.
That is a myth.
That addiction is a choice.
It is not a choice. That is a myth. And most people usually confuse that. They usually blame the individual and say that it's a personal decision that they're making. Well, in real sense, addiction is a disease. That's why we said by saying that addiction is a chronic illness. It's a chronic condition.
Wow, wow.
So it's a disease which needs to be looked at.
Yes.
Needs to be diagnosed. The same way you get a flu and you go to the hospital and you get treated, the same way that's how we treat addiction. You go to a rehabilitation center and you get treated. So addiction is not a choice.
It's not a choice.
It's a disease.
Wow.
Yes.
So one thing that we are understanding it very clearly, because now we are unmasking these giants called addiction. And because, so it's not a choice.
It's not a
so
choice.
when you see an individual who is maybe has the withdrawal symptoms, who has been must use this and love again, it's not his or her choice.
It's not the person's choice. That is a disease.
It's a disease. Wow, wow. And I love the fact that it being a disease, there is a treatment.
Yes.
Wow, wow.
Yes.
Our viewers like that addiction, it's not a choice. It's a disease. It's a disease. And we have begun by discussing also the stages of addiction. How does it develop? And it indeed is true that it's a disease. It's a disease. Wow. Which other myths that it's people have mates?
Yeah.
People have mates.
The second myth, and I think this is one of the most common ones that maybe make people fear even to come to rehabilitation. And this one is most people usually think that a rehabilitation center is a place where for mental patients, for an asylum. What people don't understand is that a rehabilitation center, it covers all aspects.
Yes.
Mostly there's addiction. The people who are going through addiction for substances. The people who are going through addictions for behavior. And the people who are going through other mental health challenges. But in addiction, the concept of addiction, a rehabilitation center is where people are taken for treatment. To help them understand the concept of addiction and to help them go into recovery.
Wow. So a rehabilitation center is not only a place for now the myth that people have, or the notion that when you mention a rehabilitation center, what comes into our mind, for example. Now the first time you had that word rehabilitation center, what came into your mind?
Mathare. These ones are just mentally unstable.
Yes.
And that's not the case.
In fact, they are this word that they use, and in fact, it brings about stigmatization a lot of almost every time. When which is this word? When we call them mad people.
Yeah, mad people, cheesy, such kind of words.
Yes. But now, give us the fact. Now that we know that rehabilitation center is not only for mental ill patients, what about which is the fact about now this? this myth?
The fact is that a rehabilitation center is where people going through substance abuse disorders, they get the chance to go there and detoxify and be able to heal from that disease that we are calling addiction. So as much as there are other, it's a counseling center, as much as people go there for counseling, people also go to, as much as people go there for counseling, people also go there to recover.
Wow,
Yes.
wow,
Yeah.
wow. And that brings me to an attention that we need to have a show on a rehabilitation center. What is it?
Yes.
Just to create awareness, because
Yes.
many people have been stigmatized,
Yeah.
and that as you said,
Yeah.
it makes them even not good to seek for assistance,
Yeah.
not go for help. Not knowing that by the way, it's a very nice place.
Yeah.
It's a very nice place. I've worked in several rehabilitation centers, and I can tell you it's a good place where you go there and get to understand into details what is this now, this disease.
Yeah.
What is this disease now? Which other myth do people have?
Okay, so the other myth that we have about addiction is the concept of that it only entails substance abuse.
Wow,
But we
wow.
have to understand that there are other concepts of addiction. It's not just substance abuse. It's not just about the drugs.
Yes,
There's
yes.
also behavioral. The fact is, addiction isn't just about substances.
Yeah.
It's also about behavior. Things like gambling, things like eating disorders. The people who eat as a way of escape, stress eating. Things like, yeah, sex.
Yes,
Sex
yes.
addiction.
So you can be addicted to sex.
You can be addicted to sex.
Wow, wow.
So as much as we go there and say that we are addicted to a certain drug, we also treat other aspects of behavior, like now gambling, pornography, and such things. So it's not just about the drugs.
It's not about the drug.
Yes.
Wow, wow.
Yeah.
But to our viewers, now the first time when you heard the word addiction, what came into your mind? I can bet 90% of the people I know, what come into their mind is the substance abuse.
Yeah.
So addiction is not all about substance abuse.
No, it's
There are other forms of addiction.
Yes.
Wow, wow, wow. And Councillor Christine she has mentioned something to do with sex addiction. So you can be addicted to sex.
Yes.
You can be addicted to gambling. Which other form of addiction?
Eating.
Eating.
Yeah, the people who have eating disorders.
Yes, yes,
It's
yes.
a form of addiction.
Wow.
Some people use eating as an escape. Once you're escaping from something,
Yes.
you're not dealing with it. It becomes an addiction.
Wow.
The same way people escape reality using alcohol. You can also use food as an escape.
Wow,
Yeah.
wow, wow, wow. So that means now, something that we are understanding here, because we are in the process of creating awareness, that addiction is not all about substance abuse.
Yes.
Wow, wow.
Yeah.
Which other myth?
Yes. Another myth is that addiction only affects the individual. That is a myth.
It's a myth.
Addiction doesn't only affect the individual. In fact, we say that addiction is a family disease.
Wow,
It affects the entire family. In what sense? When I say it affects the entire family, I mean that when a family member
Yeah.
has taken their person to a rehabilitation center,
Yes.
they're left with feelings of anxiety, feelings of stress, feelings of even depression.
Yes.
Some of the things that maybe the particular addict has done back at home might have left an impact on the family. The family members might be having stress, depression, pressure, other issues. So when we say that it's an individual disease, that it only affects the individual, that is not the case. It
Yes.
affects the entire family and the people around you.
Yeah.
Yeah.
Wow. So it's not an individual problem.
It's not an
It's not
individual.
an individual
Yeah.
disease.
Yeah.
Meaning, if I'm addicted, I affect my whole family.
Yeah.
Either nuclear family, extended
Yes.
family.
Yes.
Wow, wow, wow. So we need not to pinpoint when that individual in the family. That means when it comes now to the treatment, do we need to treat this individual or do we need to treat the whole family?
We actually treat the whole family. We have sessions where I guess we'll deal with the individual, but we also deal with the family because the
Yes.
family also has to understand the concept of the addiction.
Yes,
They also have to understand that this person is not a choice.
Yeah,
It's a
yeah.
disease.
It's a
Some of
disease.
them don't understand. You know, they try to understand what is going on with my child, with my partner, etc. They don't get it.
Yeah.
So also for them to understand it and actually be there in the healing process, we need to also help them go through the stages of understanding addiction.
Wow.
Yeah.
Wow, wow, wow. And that's the reason as why in the rehabilitation center we have a session on a psychoeducation where
Yeah.
you have maybe different topics to help this individual now come to realization, this is a disease.
Yeah.
That this is not, it's not only affecting me, but it's affecting the entire family.
Yes.
Wow. To our viewers, have you heard that? That this disease, it's not an individual choice. It's not an individual choice. Now, when you get addicted, it affects the entire family. Meaning, and the counselor has elaborated that and has said that when it comes to the treatment, the whole family need to go through this psychoeducation so that they may understand this individual. In fact, we call them identified. Is this individual just an identified problem in the whole system, right? So, if you are a parent, if you are a husband, if you are a wife, if you are a child who is addicted, know this, that it's not your only problem. It's the family problem. Wow, wow, wow. Thanks so much for bringing that insight. Which other myth do people have?
Another myth that we have about addiction is that you have to get to rock bottom for you to seek treatment.
Yeah.
I think we've discussed that previously, but it's a myth. You don't have to get to rock bottom for you to seek help. The fact is, at any given stage, even at experimental, you can decide that you've reached experimental, you've tested it, it's not working out for you, and maybe you're about to get into the next stage. You can identify it in the beginning. You can identify it when it's problematic, and also you can identify it when it's rock bottom. So you don't have to get to rock bottom for you to seek help. Help starts at the beginning.
At the beginning.
Yes.
Wow, wow, wow. Our viewers, have you heard that? That you need not to get to the rock bottom. Now, one of our viewers could be here and is asking, what is this rock and bottom?
Okay.
Can you help us understand? Because you are creating awareness. What is this rock bottom? Because you are saying it's a myth that someone needs to get to the rock bottom that he or she may go for help or go for either counseling or whatever kind of help, right?
Yeah.
Now, what is this rock bottom?
Okay. So rock bottom is whereby you feel like life has reached its end. It's whereby you feel like there's no tomorrow. You're not seeing past today. It's why you're feeling feelings of hopelessness, why you're feeling like worthless. You're feeling all sorts of things. If it's a job, maybe you've lost your job. That's rock bottom. If it's your family, your marriage, maybe you've messed up your marriage, your family has left you, you need to start from scratch. If you end up losing your job and you get unemployed, you can't pay for your rent. If you have kids, how will you pay for the school fees, for the upkeep? That is rock bottom, whereby you feel like you're hopeless, like your life doesn't have any purpose. That is rock bottom. Yes.
In simple word, do you want to mean hitting the rock bottom? It's like you feel you have come to the end of the life.
Yes.
There's no hope.
Yeah.
Wow, wow. So for this myth that you need now to get to that point for you to seek help, it's a myth.
Yeah, it's a myth because you can seek help at any given time.
Yes.
Most people, when they reach rock bottom, you'll find them having suicidal ideations because you feel like there's no hope. Without hope, you feel like you want to end it all.
Yes.
You know. So when I say rock bottom, I say it's rock bottom. I say that because it's where you feel like the life has no meaning anymore. Yeah.
So seek help as early as possible.
As early as possible.
Wow,
Yes.
wow.
Yes.
I don't know how obvious whether you're learning from this myth. In fact, I love the way you are bringing them out. There is a myth, then bring the fact.
Yes.
So that now we are able to understand. Now, yes, this is a myth, and now this is the fact. Now the truth, right?
Yeah.
The truth. And are there any other myths?
Yes, there's also this other myth that
Yes.
in order that everyone who enters a rehabilitation, they have to relapse. I don't know if you've heard that one.
So it's a myth.
It's a myth. People usually say that, you see this one, he went to rehab, he or she, of course, they're going to relapse.
Yes.
It's a myth. We usually say that relapse can be part of recovery.
Yeah.
It can be. But you don't go looking for it. But it can be
It
part
can
of
be.
recovery. You don't go looking for it. And it's not necessarily that every person who goes through treatment
Yes.
will relapse. Everyone's recovery journey is different.
Yes.
Everyone's path is different. So it's not necessarily that every person who goes to a rehabilitation
Yes.
will relapse.
Yes.
No. That's not the case. Yeah.
So, by the way, that's on this myth.
Yeah.
I think it's a myth that can make someone not go looking for help.
Yes.
And can make this person not
Yeah.
even go and to a rehabilitation center. Why? Because he or she feels that if I go to a rehabilitation center, I will relapse.
Yeah.
Because there's that notion that if I go to the rehabilitation center, I must relapse.
Yes.
I've heard them say, or I read somewhere, that relapse, it's a part of recovery. Is it true?
Yes.
Because you're working in a rehabilitation center, is it true that relapse it's a part of recovery?
Yes. Relapse is or can be
Yes.
a part of recovery. But the difference is we don't go looking for it.
Yes.
As we teach our clients in the rehabilitation center,
Yes.
we do say that yes, it is part of recovery. And why do we say that? So that when a person, let's say, tunasemanga kuteleza si kuanguka,
Yeah,
right?
yeah,
The mistake is staying back, is staying down there, right? So we tell them that yes, it's part of recovery, but
Yes.
don't go looking for it. A person who's maybe relapsed, high chances, and if you show this person that relapse is not part of it,
Yes.
atasikia guilt. So this person won't want to come back and seek for help. But a person who faces relapse and then decides that, nimeteleza, but let me go seek for help so that nisiteleze tena. I don't know if I've answered your question.
Yeah.
So it is part of recovery for some people, but don't go looking for it.
Wow.
That's the difference. Yeah.
So it can be.
It can be.
So it's not a must to relapse for you to know, I'm in the process of recovery. So it's not a must.
It's not a must.
But it can be part.
But it can be.
Wow.
Yeah.
Just hold on there. Don't go anywhere. We are coming back. We are going for a short break. Then we are coming back. So now we may come with a fact. Now we have realized that now this relapse, that when it's a myth that it's a must you relapse when you go to a rehab. Now we are coming back with a fact. Is it true? Must you relapse? Must you relapse so that you may know you are in the recovery journey? So we are going for a break. We are coming back. Stay tuned. Looking forward to see you. Hope you are getting. Hope you are getting to unmask this giant called addiction, and hope you are getting your awareness is getting enlightened. Looking forward to see you after short break. Good morning, good evening, good afternoon, depending from where you are watching us from. My name is Kevin Mugo. I'm a counseling psychologist. I want to welcome you to this channel that is Makrak TV, a channel that is aiming to create awareness, inspire hope, and create awareness and also inspire hope. We'll be having a lineup of shows that we'll be bringing to you every Monday, Tuesday, Wednesday, and Thursday. Now, someone might be asking, what is Makrak TV? Makrak is just an acronym. M stands for mental health, A stands for addiction, C stands for career, and LG stands for loss and grief. Now, every Monday we'll be bringing a show on mental health where we'll be having an expert and also a guest. An expert is a professional who will, when the guest is sharing his or her story, an expert in that field, either a psychiatrist or a psychologist or a clinical psychologist or any expert in that field will be helping to expound, to bring about clarity in that area. Even to our viewers, if you be having any question, you can be chatting through the numbers that are on your screen, and we'll be able to respond to those questions together with our guests and with our experts. Now on Tuesday we'll be bringing a show on Addiction, yes, addiction. Are you going through any form of addiction? Is it a drug addiction, or we'll be discussing into details types of addiction, how do you get into addiction, the stages of addiction, and how can you get out of addiction? We'll still be having a guest and also an expert be bringing to the show rehab CEOs to help us also expand on this field. Now, on Wednesday, we'll be doing a show on career guidance. Yeah, especially this is good for our students. Do you have are you stuck in on your journey to career? You don't know which career path to choose? Worry not. In this show, we'll be having those discussion. On Thursday, we'll be having a show on loss and grief. Yes, I know loss and grief, it's another area that's people feel stuck in this area, loss and grief. So we'll be having also an expert and also a guest. So welcome, stay tuned for our shows every Monday, Tuesday, Wednesday, and Thursday. Looking to see you. You can chat us on those on the numbers on your screen in case you have you if you want to also to be part of our guest. Reach out to us. Stay tuned. See you in the next show. God bless you. Stay tuned, stay locked. Macrack TV, creating awareness, inspiring hope. Thank you. Good morning, good evening, good afternoon, depending from where you are watching us from. My name is Kevin Mugo. I'm a counseling psychologist. I want to welcome you to this channel that is Macrack TV, a channel that is aiming to create awareness, inspire hope, and yeah, create awareness and also inspire hope. We'll be having a lineup of shows that we'll be bringing to you every Monday, Tuesday, Wednesday, and Thursday. Now, someone might be asking, what is MACRAC TV? MACRAC is just an acronym. M stands for mental health, A stands for addiction, C stands for career, and LG stands for loss and grief. Now, every Monday we'll be bringing a show on mental health where we'll be having an expert and also a guest. An expert is a professional who will, when the guest is sharing his or her story, an expert in that field, either a psychiatrist or a psychologist or a clinical psychologist or any expert in that field will be helping to expound to bring about clarity in that area. Even to our viewers, if you be having any question, you can be chatting through the numbers that are on your screen, and we'll be able to respond to those questions together with our guests and with our experts. Now, on Tuesday, we'll be bringing a show on addiction. Yes, addiction. Are you going through any form of addiction? Is it a drug addiction, or we'll be discussing into details types of addiction, how do you get into addiction, the stages of addiction, and how can you get out of addiction? We'll still be having a guest and also an expert be bringing to the show rehab CEOs to help us also expand on this field. Now, on Wednesday, we'll be doing a show on career guidance. Yeah, especially this is good for our students. Do you have are you stuck in on your journey to career? You don't know which career path to choose? Worry not. In this show, we'll be having those discussion. On Thursday, we'll be having a show on loss and grief. Yes, I know loss and grief, it's another area that's people feel stuck in this area, loss and grief. So we'll be having also an expert and also a guest. So welcome, stay tuned for our shows every Monday, Tuesday, Wednesday, and Thursday. Looking to see you. You can chat us on those on the numbers on your screen in case you have you if you want to also to be part of our guest. Reach out to us. Stay tuned. See you in the next show. God bless you. Stay tuned, stay locked. Macrack TV, creating awareness, inspiring hope. Thank you. Good morning, good evening, good afternoon, depending from where you're watching us from. My name is Kevin Mugo. I'm a counseling psychologist. I want to welcome you to this channel that is Makrak TV, a channel that is aiming to create awareness, inspire hope, and yeah, create awareness and also inspire hope. We'll be having a lineup of shows that we'll be bringing to you every Monday, Tuesday, Wednesday, and Thursday. Now, someone might be asking, what is MACRAC TV? MACRAC is just an acronym. M stands for mental health, A stands for addiction, C stands for career, and LG stands for loss and grief. Now, every Monday we'll be bringing a show on mental health where we'll be having an expert and also a guest. An expert is a professional who will, when the guest is sharing his or her story, an expert in that field, either a psychiatrist or a psychologist or a clinical psychologist or any expert in that field will be helping to expound to bring about clarity in that area. Even to our viewers, if you be having any question, you can be chatting through the numbers that are on your screen, and we'll be able to respond to those questions together with our guests and with our experts. Now on Tuesday we'll be bringing a show on addiction. Yes, addiction. Are you going through any form of addiction? Is it a drug addiction, or we'll be discussing into details types of addiction, how do you get into addiction, the stages of addiction, and how can you get out of addiction. We'll still be having a guest and also an expert be bringing to the show rehab CEOs to help us also expound on this field. Now on Wednesday we'll be bringing a show on career guidance. Yeah, especially this is good for our students. Do you have are you stuck in on your journey to career? You don't know which career path to choose? Worry not. In this show we'll be having those discussion. On Thursday we'll be having a show on loss and grief. Yes, I know loss and grief, it's another area that people feel stuck in this area, loss and grief. So we'll be having also an expert and also a guest. So welcome, stay tuned for our shows every Monday, Tuesday, Wednesday, and Thursday. Looking to see you. You can chat us on the numbers on your screen in case if you want to also to be part of our guest. Reach out to us. Stay tuned. See you in the next show. God bless you. Stay tuned, stay locked. Makrak TV, creating awareness, inspiring hope. Thank you. Good morning, good evening, good afternoon, depending from where you're watching us from. My name is Kevin Mugo. I'm a counseling psychologist. I want to welcome you to this channel that is Makrak TV, a channel that is aiming to create. All right, welcome back after that short break. Now we are still on the mails and fact, and there's a question, there's a rhetoric question I thrown to us. Are these myths and misconceptions, could they be the reason as to why people not go to seek for help? And I said by the end of this show, we have come to understanding and answer whether it says a yes or it's a no. And we have been learning a lot, by the way, about these myths. And I like the way you're bringing them out, where we are having now the myth, and now we bring in the fact. Now, welcome back. Now, tell us more. Where were we?
Yeah, we were talking about the myths and
Yeah.
facts about rehabilitation and addiction.
Yes,
Yeah?
yes.
And there's one other myth that we've not mentioned yet. And the myth is that addiction only affects people who are weak.
People who are
People
weak.
who are weak people, or people who lack willpower.
Yes, yes.
That is
yes.
a myth. That is a myth.
Yes, a myth.
Addiction can affect anyone,
Wow.
regardless of status, regardless of position, regardless of who you are.
Yes, yes, yes.
It can affect anyone. So it doesn't mean that because you identify as weak,
Yeah.
or you see that this person is weak, that is why this person is an addict. Addiction affects everyone, regardless.
Wow,
Yeah.
wow. Even before we get to that myth, we were here on relapse.
Yes.
Yes, and we have said that it's not a must when you go to a rehab, you relapse, so that you may know you are in the recovery. It's not a must.
Yes.
Now, someone could be asking him or herself, what is this relapse? Maybe you can shed a little light on that. What is this relapse? When you say that it's not a must you relapse, what do you mean? What do you mean?
Okay. So when you go into treatment or when you go into into a rehabilitation center, it means that first of all you identify as, you realize that you are an addict and that you have a problem. In realizing that, a rehabilitation takes a period of 3 months for treatment, inpatient. So when you're being treated, you realize that you have a problem and that you are in addiction. When we say that a person has relapsed, it means that either this person has gone back to using the particular drug of choice that he or she was using before. When you go into treatment, you stay in without using any drugs for a period of 3 months. 3 months without using any of these substances. Without using alcohol, if it's marijuana, any substances, you stay for 3 months. When we say that someone has relapsed after treatment, it means that this person, after treatment, has gone back to using the same things that he or she was using before. And if it's behavior, because we've said there's also behavior addiction, if it's behavior, you find that this person has gone back to the same behaviors as before. So when we say relapse, it means going back to the old patterns of behavior or going back to using the things that we were using before. Yeah.
So that means relapse, what I'm getting, it's going back either to the behavior or going back to the substance of choice.
Yes.
I love this.
Yes.
It's not every substance, but the substance of choice.
Yes.
That's now going back. So when you go through the process, the rehabilitation process, it's not a must you relapse, not a must you go back to the using for you to know that you are in the recovery, right?
Yes.
Now, what happens if someone relapses? What happens?
As I had said previously, I said one thing. I said kuteleza si kuanguka. Once you realize that you have relapsed,
so there is hope.
There is hope. Once you realize that you've relapsed, you don't stay down there in those feelings of guilt, because when someone relapses, there are feelings of guilt and shame. Because you feel like people have spent so many resources in trying to help you. So some people don't talk about the relapse part of it. They feel a lot of guilt. But that's where the problem is. When you fall and when you see that you have maybe gone back to your drug of choice, identify that that was a problem, accept it and acknowledge it. Once you accept that you made a mistake, you can be able to rectify it. So when you relapse, yes, it's possible for you to relapse and still get back up and still continue the recovery. Yes.
Wow, and I look forward to that show that we'll be covering on a relapse. Why do people relapse? Do you have of relapse? And what can you do for you not to relapse? Because by the relapse, it's possible in the recovery. Right? But now, kuna kitu moja ambacho umesema that kuteleza sio kuanguka. And the journey of recovery, once you have relapsed, I've heard you clearly mention that you begin by admitting first. You admit anyway, ishafanyika. Then now you begin go to the next step. Now, ikishafanyika, what do I need to do? All right? Wow. Now, which is this now? Let's now go back to this other myth that you had mentioned.
For the myths.
Yes, for the myths, yes.
The other myth is that recovery is a one-time, recovery, or rather going to rehabilitation is a one-time thing for you to recover. Or rather, it's a one-time thing.
It's a one-time thing.
For you to recover.
Ngoja. So, sio one time. So, recovery kwenda kwa rehab, sio one time. Tell us more about this. Yes.
It's something that is ongoing. As we've said in the beginning, addiction is a disease, right? For you to continue managing this disease, you have to keep on checking back in to see the doctor.
Yes.
So the same case with addiction. Unaweza pata you've left rehabilitation and then you think that now I am fully recovered. You're not fully recovered, but you're in the process of healing.
Yes.
You are. So you have to go back for follow-up sessions. You have to go back to your roots. You have to identify
in long-term recovery, right? Now, having known that that's not a one-time thing, does not guarantee to recovery, what do we need to do now? What's the fact?
Yeah, the fact is you have to continue working on your recovery.
Yes.
Because recovery is a process. As we said, it's a process. So when I say continuing to work on your recovery, it means coming back. Usually a slogan that they use back in the rehabilitation where I work says keep coming back. When you say keep coming back, that means come back for follow-up sessions.
Yes.
Come back and talk about how you're doing in your life so far. What are the stressors? Because once you go out there, when you're in a rehabilitation center, it's a safe space. These drugs are not there. When you're in the rehab, these drugs are not there. You're living a life of sobriety by force. By force.
By force.
Because you don't have that accessibility.